Every morning you see more hair on your pillow than you did yesterday. When you run your fingers through your hair in the shower, strands come away in clumps that make your heart sink. You've tried switching shampoos, you've tried supplements, you've even tried those expensive treatments at the salon, but nothing seems to work. And here's what terrifies most women over 60, what keeps them up at night: the fear that this is just how it's going to be from now on, that the thick, beautiful hair you once had is gone forever, and there's nothing you can do about it. But what if I told you that the reason you're losing your hair has nothing to do with age itself? What if the real culprit is something you're doing every single day without even realizing it, something so common, so seemingly harmless, that 90% of women over 60 make this exact same mistake? And the worst part? The longer you continue making these mistakes, the more permanent the damage becomes. Your hair follicles are literally dying as we speak, shrinking down to nothing, and soon they won't be able to produce hair at all. In the next few minutes, I'm going to reveal the 6 devastating mistakes that are causing your hair loss, starting with number 6 and working down to the absolute worst offender, the one mistake that's probably destroying your hair right now as you watch this. And if you stay with me until the end, I'll show you exactly how to reverse each one of these mistakes with simple, proven fixes that work specifically for women over 60. No expensive treatments, no dangerous medications, just the truth about what's really happening to your hair and what you can actually do about it. But I need you to watch every single second of this video because each mistake builds on the last one, and if you miss even one, you won't get the full picture of why your hair is falling out. So let's not waste another moment while your hair follicles continue to die. Quick pause, comment your age and where you're watching from, then subscribe so you don't miss what most people never learn. The last part of this video uncovers one small change that helps your body adapt to this shift. Now, before we dive into mistake number 6, I need you to understand something crucial about what's happening inside your scalp right now. After age 60, your hair follicles become incredibly vulnerable to certain triggers that younger women can handle without any problem. Think of your follicles like tiny gardens that need very specific conditions to grow. When you're younger, those gardens are resilient, they can handle a little neglect, a little stress, and they bounce right back. But after 60, those same gardens become delicate. One wrong move and the plants start dying. The problem is, most women don't know this, so they keep doing things that worked fine when they were 40 or 50, not realizing they're now killing their hair follicles. And once a follicle dies, it's gone forever. No treatment can bring it back. That's why time is so critical right now. Every day you continue making these mistakes is another day you're losing follicles that can never be recovered. So let's talk about mistake number 6. And this one shocks almost everyone when they hear it. Mistake number 6 is washing your hair too frequently with harsh shampoos. Now, I know what you're thinking. How can keeping my hair clean be a mistake? But here's what's really happening. After 60, your scalp produces significantly less natural oil, something called sebum, than it used to. This sebum is crucial because it protects your hair follicles and keeps your scalp healthy. But when you wash your hair every day or every other day with regular shampoo, especially those clarifying or volumizing shampoos that promise to give you fuller hair, you're stripping away every trace of this protective oil. Your scalp becomes dry and irritated, your follicles become inflamed, and inflamed follicles cannot produce healthy hair. In fact, chronic inflammation is one of the leading causes of permanent hair loss in women over 60. And here's the kicker, that tight, itchy feeling you get after washing your hair, that's not normal. That's your scalp screaming for help. Every time you feel that sensation, you're doing damage. The solution is counterintuitive but proven. You need to wash your hair less often, ideally just twice a week. And when you do wash it, use a sulfate-free, moisturizing shampoo specifically designed for mature hair. Look for ingredients like argan oil, coconut oil, or shea butter. These ingredients clean your hair gently while actually adding moisture back to your scalp. And on the days you don't wash, use a dry shampoo or simply rinse with water. I know this feels strange at first, like you're not taking care of yourself, but I promise you, within 2 weeks of making this change, you'll see less hair in your drain. Your scalp will feel healthier. Your existing hair will look shinier and fuller, but washing your hair too often is just the beginning. The next mistake is even more damaging, and it's something almost every woman over 60 does without thinking twice. Mistake number 5 will surprise you because it involves something you probably consider essential to looking good, and you definitely don't want to miss this because it directly accelerates hair loss in a way that most doctors won't even mention. Are you ready for this? Mistake number 5 is using heated styling tools without proper protection. Now, you might think you're being careful with your flat iron or curling wand or blow dryer, but unless you're taking very specific precautions, or literally burning your hair at the cellular level. Here's why this is so much worse after 60. Your hair shaft naturally becomes thinner and more fragile as you age. The protective outer layer, called the cuticle, starts to break down. When you apply direct heat to this already compromised hair without a heat protectant, you're causing something called thermal degradation. The proteins in your hair, primarily keratin, start to denature and break apart. It's the same process that happens when you cook an egg. The proteins change structure and can never go back. But here's the really devastating part, that heat doesn't just damage the hair you can see, it travels down the shaft and damages the follicle itself. Studies have shown that repeated heat exposure can cause follicular inflammation and miniaturization, which means your follicles literally shrink and start producing thinner, weaker hair until eventually they stop producing hair altogether. And if you're blow drying your hair every time you wash it, using a flat iron to smooth out frizz, or curling your hair with heat even once or twice a week, you're accelerating this process dramatically. The fix is simple but non-negotiable if you want to keep your hair. First, reduce heat styling to once a week maximum. On other days, embrace air drying and heatless styling methods like foam rollers, braiding, or pin curls. Yes, these methods take more time, but they actually work beautifully on mature hair. Second, when you absolutely must use heat, always, and I mean always, apply a heat protectant spray first. Look for products with silicones like dimethicone or cyclomethicone. These create a barrier between your hair and the heat. And third, lower the temperature. Most women use flat irons set at 400 or even 450 degrees. That's insanity for fragile aging hair. Set your tools to 300 degrees maximum. You'll still get the style you want, but you won't be destroying your follicles in the process. Now, I can see some of you thinking, okay, these first 2 mistakes make sense, but they seem manageable. Well, hold on, because the next mistake is where things get really serious. Mistake number 4 is actually something your doctor might have told you to do, which is why it's so insidious. And if you're making this mistake right now, you need to stop immediately because it's literally choking the life out of your hair follicles. Mistake number 4 is not managing your stress and cortisol levels. Now, I know everyone talks about stress, but let me tell you exactly what stress does to your hair after 60, because this is specific and it's terrifying. When you experience chronic stress, your body produces elevated levels of a hormone called cortisol. In your 20s and 30s, your body can handle these cortisol spikes pretty well. But after 60, your hormonal system is already in flux due to menopause and post-menopause changes, and added cortisol throws everything into chaos. Here's the mechanism. Elevated cortisol increases inflammation throughout your body, including in your scalp. It also disrupts the normal hair growth cycle. Your hair grows in 3 phases: anagen, which is growth, catagen, which is transition, and telogen, which is rest. Normally, 90% of your hair is in the growth phase at any time. But chronic stress and elevated cortisol push more and more hair follicles into the telogen phase prematurely. Then, anywhere from 6 weeks to 3 months later, all of that hair falls out at once. This is called telogen effluvium, and it's one of the most common causes of sudden hair loss in women over 60. But here's what makes this even worse. If the stress continues, those follicles don't just go back to the growth phase. They can stay dormant or even die permanently. And the stress doesn't have to be something major like a death in the family or a divorce. Chronic low-level stress counts too: worrying about finances, caring for a sick spouse, dealing with family drama, not sleeping well. These all elevate your cortisol. So what's the fix? You need to actively manage your stress levels as if your hair depends on it, because it literally does. This means implementing daily stress reduction practices. The most effective ones, backed by research, are meditation or deep breathing for at least 10 minutes a day, regular moderate exercise like walking for 30 minutes 5 days a week, and getting 7 to 8 hours of quality sleep every night. You also might want to consider adaptogenic supplements like ashwagandha or rhodiola, which have been shown to lower cortisol levels naturally. But check with your doctor first, especially if you're on other medications. The point is, you can't just say you'll try to stress less. You need actual daily practices that physically lower your cortisol, or your hair will continue falling out no matter what else you do. Now we're getting into the really critical mistakes, the ones that cause the most damage. And mistake number 3 is something that's probably sitting in your bathroom cabinet right now, something you might even be taking because you think it's good for you. But for your hair, it's absolute poison. And once I tell you what it is, you're going to want to check your medications immediately. Mistake number 3 is taking medications or supplements that accelerate hair loss without realizing it. This is huge, and almost nobody talks about it. There are dozens of common medications that list hair loss as a side effect, and many women over 60 are taking multiple medications, which compounds the problem. The worst offenders? Blood pressure medications, especially beta blockers, cholesterol-lowering statins, antidepressants, particularly SSRIs, blood thinners like warfarin, thyroid medications if the dosage isn't quite right, hormone replacement therapy if the balance is off, and even some arthritis medications. But here's what makes this so frustrating. Your doctor probably knows that these medications can cause hair loss, but they often don't mention it because they consider your blood pressure or cholesterol more important than your hair. And medically, they're not wrong, but you deserve to know the full picture so you can make informed decisions and explore alternatives. And it's not just prescription medications. Certain supplements can cause problems too. Taking too much vitamin A, for instance, is directly linked to hair loss. Overdoing selenium can cause it. Even too much vitamin E can be problematic. And if you're taking multiple supplements without knowing exactly how much of each vitamin or mineral you're getting, you could easily be overdosing. So here's what you need to do right now. Make a list of every single medication and supplement you take. Then sit down with your doctor or pharmacist and ask specifically which ones might be contributing to hair loss and whether there are alternatives that don't have this side effect. For blood pressure, for instance, ACE inhibitors tend to be better for hair than beta blockers. For depression, some newer antidepressants have lower rates of hair loss. The point is, there are often options, but you have to ask. And for supplements, less is often more. Get a comprehensive nutrient panel blood test to see what you actually need, then supplement only those specific deficiencies with appropriate doses. Don't just take a general multivitamin plus separate vitamins and minerals. You're almost certainly overdoing something. And remember, it can take 3 to 6 months for medication-related hair loss to show up, and another 3 to 6 months for it to recover after you stop the offending medication. So the sooner you address this, the better. All right, we're down to the final 2 mistakes, and these are the absolute worst offenders. These are the mistakes that cause permanent, irreversible hair loss if you don't catch them in time, and I'm willing to bet that at least one of these applies to you right now. Mistake number 2 is critical. And when I reveal it, I want you to think carefully about whether this might be what's happening to you. Mistake number 2 is having an undiagnosed or poorly managed underlying health condition that's destroying your hair from the inside out. This is where things get medical, but stay with me because this could be the missing piece of your puzzle. The most common conditions that cause hair loss in women over 60 are thyroid disorders, particularly hypothyroidism, iron deficiency or anemia, vitamin D deficiency, biotin deficiency, zinc deficiency, autoimmune conditions like lupus or alopecia areata, hormonal imbalances, particularly low estrogen and progesterone after menopause, insulin resistance or diabetes, and chronic inflammation from conditions like rheumatoid arthritis. Here's the problem. Many of these conditions develop slowly and cause vague symptoms that you might dismiss as just part of getting older. You feel tired? Well, you're over 60, of course you're tired. Your hair is thinning, that's just aging. Your joints ache, that's arthritis, what did you expect? But meanwhile, these underlying conditions are steadily destroying your hair follicles. And here's the really important part. Standard lab tests often miss these problems because they use reference ranges that are too broad, especially for older adults. Your thyroid function might be at the low end of normal, which technically isn't hypothyroidism, but it's low enough to cause hair loss. Your iron might be in the normal range, but it's not optimal for hair growth, which requires ferritin levels above 70%. Your vitamin D might be above the deficiency threshold, but still too low for healthy follicle function. This is why you need comprehensive testing and a doctor who understands optimal ranges, not just normal ranges. Specifically, you need a full thyroid panel including TSH, free T3, free T4, and thyroid antibodies. You need a complete iron panel including ferritin, not just hemoglobin. You need vitamin D, vitamin B12, zinc, and a comprehensive metabolic panel. And if everything comes back normal but you're still losing hair, push for additional testing like hormone levels or inflammatory markers. The fix depends on what you find, but the point is, you can't fix what you don't know about. And if you do have an underlying condition, treating it properly often results in significant hair regrowth within 6 to 12 months. But you have to identify it first. And now we've arrived at the number one mistake, the biggest, most devastating mistake that's causing hair loss in women over 60, and this one is going to make you angry because it's completely preventable, yet almost everyone does it. This is the mistake that ties all the others together, and if you fix this one thing, everything else becomes easier. Mistake number one is not getting enough protein and essential nutrients specifically for hair growth. This is it. This is the big one. And here's why it's so critical. Your hair is made of protein, specifically a protein called keratin. To produce hair, your body needs adequate protein intake plus specific vitamins and minerals that help synthesize that protein into hair. But here's what happens after 60. Your appetite often decreases. Your ability to absorb nutrients raw food declines. You might be eating less meat or protein for health reasons. You might be on a restricted diet for medical conditions. And many women over 60 are simply not getting anywhere near the amount of protein they need for healthy hair growth. Most women over 60 need at least 1 gram of protein per kilogram of body weight per day. And if you're trying to regrow hair, you might need even more, closer to 1.2 grams per kilogram. For a woman weighing 68 kilograms or 150 pounds, that's 68 to 82 grams of protein daily, and it needs to be high-quality, complete protein with all the essential amino acids, things like eggs, fish, chicken, turkey, Greek yogurt, cottage cheese, or plant-based options like quinoa, lentils, and tofu combined with whole grains. But protein alone isn't enough. Your follicles also need iron to carry oxygen to the hair matrix cells, biotin to produce keratin, vitamin C to help absorb iron and produce collagen, vitamin E to protect follicles from oxidative stress, omega-3 fatty acids to reduce inflammation and support follicle health, zinc to regulate oil production and support the growth cycle, and silica to strengthen hair strands. Most women over 60 are deficient in at least 2 or 3 of these, and many are deficient in more. This creates a situation where your body is literally rationing resources, and guess what gets cut first? Your hair. Because evolutionarily, hair isn't essential for survival, so when your body doesn't have enough nutrients to go around, it prioritizes vital organs and lets your hair suffer. This is why women who go on crash diets or drastically reduce their food intake almost always experience hair loss 3 to 6 months later. So here's the fix. And this is the most important thing I'm going to tell you in this entire video. You need to eat a hair heal. Thy diet every single day without exception. This means starting every day with a high-protein breakfast, at least 20 to 30 grams of protein, eggs with smoked salmon, Greek yogurt with nuts and seeds, or a protein smoothie with protein powder, berries, and spinach. Include a serving of fatty fish like salmon, mackerel, or sardines, at least 3 times a week for omega-3 seconds. Eat plenty of leafy greens like spinach and kale for iron and vitamin C. Include nuts and seeds, especially pumpkin seeds for zinc and walnuts for additional omega-3 seconds. And consider a targeted supplement designed specifically for hair health, something with biotin, silica, and marine proteins. Give this protocol at least 4 to 6 months because that's how long it takes for nutritional changes to show up in your hair growth. Remember, the hair you see today is the result of what you ate 3 to 6 months ago. But if you commit to this, if you really make nutrition for hair growth a priority, you will see results. Your hair will stop falling out in such large amounts. New growth will come in thicker and stronger. And over time, you'll regain much of the density you thought was gone forever. Now, if you've made it this far, congratulations, because you now know more about protecting and restoring your hair after 60 than 99% of women out there. But knowledge without action means nothing. The key is to implement these changes systematically. Don't try to do everything at once. Start with the easiest changes like switching your pillowcase and reducing hair washing frequency. Then move on to evaluating your chemical treatments and scheduling blood work to check for nutritional deficiencies. Once you have that information, you can add appropriate supplements and adjust your diet. Finally, implement the scalp care routine with daily massage and regular deep cleansing. Be patient with yourself and with the process. Hair growth is slow, and it takes at least 3 months to see noticeable changes because that's how long the hair growth cycle takes. Hair that's growing today won't emerge from your scalp for several weeks, and then it needs time to grow long enough to be noticeable. Most women start seeing improvements around the 4 to 6 month mark if they're consistent with these changes. Some see results sooner, especially with reduced breakage from the silk pillowcase and gentle hair care. Also remember that some amount of hair shedding is completely normal. We all lose 50 to 100 hairs per day as part of the natural hair cycle. The goal isn't to never lose a single hair, but to ensure that the hair you're growing is strong, healthy, and thick, and that your follicles remain active and productive for as long as possible. Your hair tells the story of what's happening inside your body. Thinning hair after 60 is a signal that something needs attention, whether it's hormones, nutrition, scalp health, or how you're treating your hair externally. By addressing these 6 mistakes, you're not just improving your hair, you're improving your overall health and well-being. You deserve to feel confident and beautiful at every age, and having healthy hair is a part of that. Don't let anyone tell you that hair loss is just something you have to accept. Yes, some changes come with age, but you have far more control than you've been led to believe. Take action today, start with one change, and build from there. Your future self will thank you when you look in the mirror and see thicker, healthier, more vibrant hair looking back at you. And if